Okay, so it's been left to me to try and set the scene by asking where do we want to get and how in the next 30 years if we are to achieve this goal of reducing violence by half. And I'll try and paint in big brush strokes a vision, a roadmap for how we're going to try and do this. I'll touch on several points that have already been alluded to. As a start, I think we need to consider critically whether the focus should be on what we call interpersonal violence as opposed to self-directed violence or suicide on the one hand and collective violence on the other. Interpersonal violence includes child maltreatment, intimate partner violence against women, sexual violence against women and men, elder abuse, youth violence. As you can see here, it accounts for 36% of deaths, according to the best estimates of 1.4 million deaths a year. And next to it is self-directed violence, accounting for much more, 58% of deaths. And on the other side, collective violence, accounting for 6% of deaths. So why should we focus on interpersonal violence as opposed to it and self-directed violence as well as collective violence? Our answer to that, I think, is coming from the evidence and is coming from some of the practicalities and the political realities of addressing violence. First of all, interpersonal violence, unlike war, affects all countries. This is also true of suicide, of course. However, unlike suicide, interpersonal violence is a risk factor for lifelong health and social problems, different forms of crime, other types of violence, non-communicable diseases, mental health, and so forth, all of which accumulate to represent a huge economic burden on countries, a huge burden on health systems, social protection systems, and so forth, i.e. high economic cost. We know that, in fact, both suicide and self-directed violence are highly predictable when we study them at the population level using epidemiological procedures, and they're very preventable. We know this for some types of violence more than others. We know this more so from information developed from studies in wealthy countries than elsewhere, but there's clear evidence for its preventability and the fact that as societies evolve, and we have Steven Pinker here, and we have Manuel Eisner's work, and we have thoughts about the civilizing process, we see very distinct and clear declines in violence in some parts of the world. And quite clearly, there's a hugely obvious role for national governments. Addressing interpersonal violence is the very stuff of what ministries of the interior, home affairs, etc. should be doing and are doing. So who are we? Are we a system? Are we a global violence prevention field? I think we'd like to think we are, and I think we are. What is a global violence prevention field? I think it's essentially a group of international actors who somehow are connected institutionally, intellectually, financially, with a shared focus very much on evidence-based prevention and control and the provision of victim services, whose task it is to support national actors. That's where things happen, obviously, on the ground at the level of communities, of government, of nations, etc. And the task of this field is to support them. And our role, I think Etienne has mentioned it and others know this, is to develop standards and norms, identify priorities, build capacity, and so forth. And I think the people in this room all epitomize what it means to be part of this field. So if we are to get to halving violence in the next 30 years, it's really easy to do that, isn't it? First of all, we've come up with some targets, and that's easy, right? We know what the global homicide rate is now. It's 8, and we need to reduce it to 4. Fine. We know that there's a global prevalence, for instance, of child maltreatment, physical abuse, 25%, so let's reduce it to 12%. Intimate partner violence, 33%, take it down to 16%, etc. These are hypothetical. In terms of processes, we know that we would also need to define some process indicators that we need to achieve in order to address the risk factors. Some of these might be increase the proportion of new parents receiving support from 20 to 60%, children receiving life skills training from 30 to 80%, the percentage of the global population covered by evidence-based policing, which Lawrence Sherman is going to talk about, from 20% to 60%, the number or the population living in societies with high inequality, reduce it from 70 to 20%, etc. Easy, right? No, these are all hypothetical. If it was that easy, we might already have such targets. There are a number of prerequisites which we have to critically reflect upon in this and other conferences that have to be met before we can even set these targets. There are scientific prerequisites and political prerequisites. Among the more obvious scientific ones are the measurement of violence itself. Even if we start with deaths, the tip of the iceberg, and probably not even the most significant component of violence, we are barely able to measure them. And it really needs a lot of critical reflection as to whether the different apparatus for bringing together information from UNODC, the United Nations Office on Drugs and Crime, WHO, Small Arms Survey, etc., are we up to speed? Can we even say that we're able to measure homicides adequately to set baselines or targets? I'm not sure. When it comes to non-fatal violence, I think we're almost certainly are not in a position to put down any baselines or targets, and we need a huge number more surveys in more countries of things like intimate partner violence against women, child maltreatment, sexual violence, and so forth. Risk factors. What we know about risk factors essentially comes from work in high-income countries. What are the risk factors that drive youth violence in Africa or in Latin America? Are they the same as those which drive it in the USA or the UK? Probably not. But maybe we don't know enough to answer that definitively. I think we all recognize that we're not good in terms of the spread of coverage about the effectiveness of prevention programs because most of our outcome evaluation studies are from wealthy settings, which are utterly different in terms of their levels of social control, self-control, institutional capacity, and so forth. And I think many of us are pushing to try and increase the ability to do such studies in low-income countries. Another prerequisite, scientific prerequisite, is to better understand the effects of social and economic policies. The 5 people you see in the picture could be doing and are doing enormous things to influence the way that violence is going through their educational policies, their policies around gender equity, their policies in relation to alcohol, firearms, inequality, family planning. David Finkel, who I think will be talking about how important are specific violence prevention programs within the climate created by these bigger policies. Is it always best to do specific violence prevention programming, or should we try and harness the prevention of violence to these macro-social determinants? I think the answer is yes and no, depending on where you are. These 5 individuals may or may not be doing things that are good for violence, and when they're not, we certainly have to do something to try and change the direction. We need also scientifically to assess what countries are doing to address violence. Etienne alluded to the Global Status Report on Violence Prevention, which is one instrument by which we can better understand what's actually being done. Then we need to build scientific capacity. In particular, in many low and middle income countries, the people charged with addressing violence have got not the first clue about what evidence-based anything means. They don't work with data. They're not numerate in the sense that we think of it in terms of population, epidemiological statistics, etc. They don't think in that way. So we need to do a huge amount, if we want them to work that way, to be able to do that work. What are the political prerequisites? First and foremost, we cannot directly alter what any government or member state or any of those 5 people in the BRICS countries is going to do in terms of policy. What we can do is clean up our own acts and ensure that our own institutions, organizations, and so forth are explicitly mandated to address interpersonal violence. WHO has recently adopted a resolution through the World Health Assembly, and it would be great to see every other international agency do the same, and international NGOs, funders, etc., do the equivalent within their own frames of reference. So, what do we have to do in order to address these prerequisites and start to get going in the right way? We could continue as we are, which is having meetings every other year in one or other format, the milestones meeting, this meeting, violence prevention alliance meetings, meetings organized by other partners. But I don't think we want to do that. I think we want to do more. We want to continue, we want to step up advocacy for global political prioritization of violence prevention. And we've already heard about it. We want to ensure that violence prevention related stuff stays in the post-2015 agenda. I'm not sure if David Stevens is here. Is David Stevens here? Okay, we've got some slides. Got some slides for you. So before we get to the post-2015, my talk's not going to be that long, don't worry. What could we ask the UN General Assembly to do? You've heard about this before, those of you who come to the WHO meetings. We should try, though, and get some champion countries to ask the General Assembly to come up with a policy document that asks countries to strengthen their violence prevention capacity and do more in terms of multi-sectoral planning. This document should also request international organizations to prepare recommendations for the adoption of voluntary violence reduction targets. Now, because we can't measure all of the violence that well, some of these voluntary targets might be around the capacity to measure or the ability to plan scientifically, and from that to develop a global plan of action to prevent violence. An example of where this has been done is in relation to non-communicable disease prevention, and you see on this slide examples of targets for the year 2025, such as 30% reduction in salt intake, 10% reduction in harmful use of alcohol, and so forth. Very different, distant targets to enhancing parenting capacity or increasing the proportion of the population subject to evidence-based policing. Coming to the post-2015 development agenda, we've already heard there are several outcomes that are relevant to violence. Eliminate all forms of violence against women and girls, reduce levels of violence and halve related deaths, end abuse, exploitation, and violence against children. We shouldn't forget, however, the process goals, if you will, that are in the current draft post-2015 document, which address several of the key risk factors that we need to address, such as drug, alcohol, and substance abuse, providing all children access to quality early childhood care, which perhaps also means early child development programming, ensuring that we integrate knowledge and skills for promoting peace and non-violence into education programs, i.e. social and life skills development training in schools, and sustaining income growth of the bottom proportion of the population so that you reduce economic inequality. So the post-2015 agenda is alive with opportunities which we need to ensure are capitalized on in order to reduce violence. I'll conclude with this. Etienne has already described the global status report. So the added value of this slide is that you're the first people outside of our department to see the cover. If you don't like it, we probably aren't in a position to change it, but there it is. So thanks very much, and sure. Okay, I will put this next slide on. Will I? Yes, I will.